This study built upon a 2024 publication in which the 18-gene MYPROSTATESCORE 2 test, or MPS2, was validated in urine samples obtained after digital rectal exam, or DRE. In that study, MPS2 demonstrated highly accurate detection of clinically significant prostate cancer, defined as Gleason score 7 to 10 or grade group 2 to 5, meaning this includes cancers that generally pose risk of harm and require treatment. The study found that MPS2 outperformed other guideline-endorsed biomarkers, as well as PSA and the PCPT risk calculator, which combines PSA with clinical risk factors. Given that rectal exams are uncomfortable for patients, the current study assessed the test in urine samples obtained without a DRE. The cohort included 266 men presenting with an elevated PSA level. We examined the clinical consequences of using the MPS2 test or the PCPT risk calculator to determine which patients should undergo prostate biopsy. It is notable that MPS2 can be performed as a biomarker-only test without clinical factors, or it can be combined with clinical factors or prostate volume if that information is available. Under a testing approach detecting more than 90% of significant cancers, all three MPS2 models led to substantial improvements in the number of unnecessary biopsies avoided, biopsies that prove to be negative or detect low-grade cancers not requiring treatment. While use of the risk calculator would have avoided 13% of unnecessary biopsies, the MPS2 models would have avoided between 36 and 42%. Findings were particularly striking in patients with a history of a prior negative biopsy, where the risk calculator would have avoided only 3% of unnecessary biopsies, compared with 44 to 53% using MPS2. Overall, the current study found that the non-DRE MPS2 test provides accuracy in line with the post-DRE test. Clinical use of MPS2 would have avoided up to 53% of unnecessary biopsies while preserving immediate detection of the vast majority of significant cancers. This suggests that MPS2 can greatly improve the clinical experience and outcomes of men presenting with an elevated PSA, with or without a previous negative biopsy. Importantly, use of urine without requiring a rectal exam expands access to the test, which can now be performed through at-home testing, for example, in patients undergoing telehealth care. Thank you for your interest in this study.